A room full of wonderful women. I was saying to Marlene that I've only ever done this for 100 men, so this is way better.
Yeah.
So I'm Lorrie Hagen. I'm the executive director of the Charles Best Diabetes Center. I joined the center in 2017, but its vision and founder opened the doors in 1989, Marlene Grass. So what's cool about the center is it is a registered charity providing frontline health care for people living with type 1 diabetes. Type 1 diabetes is different than type 2, and I'm not going to make anybody tell me what the difference is, but Claire's going to share her experience with you. So the center provides programs for all ages, pregnancy. Our youngest patient is 18 months, our eldest patient is 92. All technologies that you've seen on arms and hips and legs and everywhere. Our goal is to maintain expertise in all those areas. I'm very proud of my staff, I'm very proud of the center, and I'm most proud of bringing patients to speak on our behalf. So here is Claire.
So I am a little bit nervous. If you see me peeking at my phone, I'm just getting back on track with my script. So 3 years ago, at the age of 12, I was diagnosed with type 1 diabetes. And for a few months after not feeling like myself, me and my mom decided to go get checked out. I was confused at first because I thought diabetes was someone who didn't take care of their physical health the way it was supposed to be taken care of, but I was far from right. Type 1 diabetes is an autoimmune disease passed on through your genes, and there's no cure so far, and I have to take care of it for the rest of my life, and so does anyone who has it also has to. After being emerged overnight, I was sent to the Charles Best Center immediately. Me and my mom were both very surprised on how quickly they were able to accommodate us and make space for us with my new medical condition. They started introducing me to all these new things: needles, bolusing, and injecting insulin properly. They introduced me to carb ratios and carb counting, and I learned all these new words that probably mean nothing to you guys, and they didn't mean anything to me either. Within the first year of having diabetes, I went through over 3,000 needles, and I wouldn't have been able to understand or know how to do it if it weren't for the Charles Best Center, who helped me the way they did. As you have diabetes for longer, you get more sophisticated devices like an insulin pump and a continuous glucose monitor, which tracks my blood sugar 24/7. But there still isn't a cure. I live a regular life. I ski, I play volleyball, flag football, I've even worked 2 jobs. I walk to school every day, I do gym class, and I go to the gym too, and I eat whatever I want. But it's all thanks to the Charles Best Center that helps me live my regular life. And type 1 does not define me, and your donation would help people live regular lives just like me.
Questions now or questions after? Oh, great. Okay, great. All right. So a couple things probably worth noting. So when the center was founded, it was founded by an RN in 1989 in a physician-dominated environment. So the things that Marlene had to sort of do to be able to open the doors, register as a charity, get some physicians backing, have physicians that were willing to work with her. But her real main impetus at that point, she had about 40 patients who she'd been seeing at Ajax Pickering. And they were all with young kids at the time, and they were diagnosed with type 1. So what does this mean? Multiple needles, multiple blood checks. What does this mean for nighttime? How do I parent? What do I do if they're hungry? What if I do if they're upset? What if I do when they want to exercise? And so Marlene was just like, you know what? There's not enough time or money dedicated to type 1, and that was the moment for her. And so she started on her mission, and it really was to make sure that both the education and support and the peer networking that's available for this somewhat smaller community. I think people do think about type 2 diabetes when they hear diabetes, right? So what can we do with my lifestyle? What meds do I need to go on? What is wrong with my diet? All these things. And that is true for some extent for type 2. But there are lots of other things about type 2. The thing is, it is totally different than type 1. So you don't have a choice. You don't outgrow type 1. You have to have insulin every day. It is constantly on your mind, and just having a team to support you through all the things, like university, like going and getting married and having a baby, all of these things, like aging. So my team is made up of 8 nurses, 7 dietitians, 3 social workers, an administrative support team, a development office, a fundraising office coordinator. So we do have to fundraise between $400,000 and $500,000 a year to operate to see our over 2,000 patients a year. Yeah.